What is Tourette syndrome? Tourette syndrome is a neurological disorder that causes repeated, uncontrollable, and spontaneous movements or vocal spasms. It is a disorder that occurs in 1 in every 100 individuals in the United States alone, and for every 1 girl that is diagnosed with Tourette syndrome, 4 boys will be diagnosed. So because Tourette syndrome is a spectrum disorder, there are several different types of tics. There are simple motor tics, which are sudden, brief, and repetitive, and they include few muscles to a restricted body area. So tics can be eye blinking, head jerking, shoulder shrugging, very simple and sometimes not noticeable. Whereas a complex motor tic is obvious. It's a series of movements repeated in the same order and includes multiple muscle groups. So this could be including obscene gesturing, flapping the arms, touching the nose, anything that involves more than one thing and is always repeated in the same order. On the other hand, we have vocal tics. So a simple vocal tic is a spontaneous uttered sound and can include hiccuping, yelling, throat clearing, and even barking. Whereas a complex vocal tic is very noticeable and includes a series of words or phrases. So you can repeat one's own words or phrases, you can repeat other words or phrases, and you can also use vulgar, obscene swear words. Because not much is known about Tourette syndrome, besides that there are abnormalities in certain brain regions and in neurotransmitters, it's thought that it's mostly genetic, but there still needs to be more research done. So certain types of treatments would include medication because they think it's genetic, and also behavioral and supportive therapy to control the tics. And while living with Tourette syndrome on its own is difficult, greater difficulty lies in the associated disorders. Individuals with Tourette syndrome often have signs of inattention, hyperactivity, impulsivity, problems with reading, writing, and arithmetic, and obsessive-compulsive disorder. This can lead school administrators to think that individuals with Tourette syndrome have lower intelligence levels than other children, but individuals with Tourette syndrome, in fact, have enhanced cognitive control because most of the time they are constantly trying to suppress their tics, and that process occurs in the area of the brain closely associated with working memory, so they in fact have a greater cognitive ability than other individuals. So when we think about teaching children with Tourette syndrome, we need to realize the difficulties they face. They have shorter attention spans, they have a decreased listening ability, and it will take them longer to complete reading and writing assignments. So some quick changes that can be done to aid individuals with Tourette syndrome so that they are effectively tested would include private study areas, untimed tests, and oral rather than written examinations. To finish this off, I have a few questions for you about how we should change the educational system in order to aid these individuals with Tourette syndrome. So how is it possible for schools to administer exams in other forms besides writing, and how effective would this be? Also, what are some other solutions to aid school administrators in effectively teaching and testing children with Tourette syndrome? We've talked about multiple intelligences. Would this work for individuals with Tourette syndrome?
Made with Doodlecast Pro.